Hello, everyone. Thank you for joining us today. I'm Sadida Hosseini-Jebeli. I'm leading the Economics of Long-Term Care Interest Group within the Observatory. So the reason that we formed this interest group is the huge research gap around the economics of long-term care, and we aim to bring together health and social care researchers, policymakers, and practitioners who have got an interest in the economics and financing of the long-term care. So we will be focused on the social care and community-based interventions in response to the health and social care needs of population. And so rather than focusing on the clinical aspects, so we aim to develop the methodological aspects of measuring value for money, financing mechanisms, and impacts in this context. Let me just introduce my colleagues. We are 4 steering committee members, including myself, which I'm proud to introduce today. Cassandra Simon, who is a researcher at the European Center for Social Welfare Policy and Research in Austria. Cassandra has got more than 4 years of experience in health and long-term care comparative research and policy in the context of population aging and fiscal sustainability. We have Professor Courtney Van Houten from the Duke University in USA. Courtney is a well-known health economist and health service researcher, and she is also a research career scientist in the ADAPT Center, Research Center, U.S. Veterans Affairs. So myself, I'm a research associate in health economics in the Newcastle University. I also have got the interest in the long-term care economics, basically aging and mental health. We have Dr. Elizabeth Lemmon in this steering group who will be presenting today as well. Elizabeth has got her PhD in the economics from the Edinburgh University and from the Sterling University. She is currently working as a research fellow within the health economics group of the Edinburgh University Clinical Trial Units. So within this interest group, we aim to bring together experts from different parts of the world and different backgrounds to organizing the regular webinars. This webinar today is the first one, and we are planning to organize some other webinars, maybe 2 or 3 by the end of the year. We also share some recent publications and projects in our webpage. So I just invite you to check the webpage, and you can sign up for the interest group and be updated about the events that we are organizing. For today's presentation, we invited Professor David Bell and Dr. Elizabeth Lemmon, who kindly accepted to present their book chapter, which is recently published in the Routledge Handbook of Economics of Aging. They will be focused on defining features of market for the ELTC compared to the market in general. So I already introduced Elizabeth. Let me just introduce Professor David Bell, who is a professor of economics at the University of Sterling. He has got a strong educational and research background in economics and worked in different universities across UK. Professor Bell has been also an advisor to the number of Scottish Parliament's committees, including finance, health and sport, education and culture. And he has got a strong research interest in the long-term care economics. So just a bit of housekeeping for today. So the webinar is for 1 hour, and we will have 20 minutes of presentation, followed by 15 minutes of question and answer, where you can raise your hand to ask your question or use the chat function. At the same time, you can use the chat function to introduce yourself as well. At the end, we will have a discussion around the economics of long-term care interest group, and you will have a chance to share your ideas about this interest group. So thank you very much, everyone. I will just stop here and give the floor to Elizabeth to start the presentation. Thank you.
I think David's gonna start.
Okay,
so we'll hand over to him first, and then me.
Perfect, thank you.
So what Elizabeth and I were working on, actually completed in early 2020, was a chapter for the Routledge Handbook of the Economics of Aging, which was edited by, amongst others, Alfonso Sousa Pozo, who I've known for a long time. And he asked Elizabeth and me to write a chapter on the economics of long-term care. So that's a picture of the book. It's very expensive, is all that I will say at the moment. What I'm going to do is in terms of our overall perspective, is to spend a little time thinking about our contrasts and similarities between health economics and the economics of long-term care. And then Elizabeth will spend a little bit, well, this second part, talking about the specifics of the research that we did for the chapter that's contained in the chapter. So thinking about health economics on the one hand versus the economics of long-term care, there are differences, there are similarities in terms of healthcare and long-term care markets. Both are characterized by uncertainty, by asymmetric information, by the possibility, which we found tragically during COVID, of contagion, externalities, and there's also, due to the market imperfections, a case for the state support or provision, which varies massively from country to country. That's one thing that's blindingly obvious about long-term care, is that there is no single model that seems to have substantive adoption across different countries. In long-term care itself, we have a large unpaid workforce, which we don't have in relation to healthcare. We do have outcomes that are difficult to measure. There is a strong interaction with the healthcare system, which again caused huge problems during COVID. And we have an insurance market which is possibly even less developed than that for healthcare. And that can lead to unpredictably distributed wealth loss, which is an interesting phrase, and perhaps seems just an aside, but in fact caused one of our previous prime ministers to pretty much lose her majority in Parliament about 6 years ago. That specific issue. I want to spend a little bit of time thinking why the economics of long-term care has received much less attention than has health within the economics profession. And I put it down to 4 different things. Failure to recognize the effects of population aging, data inadequacies, difficulties of measuring outcomes relating to care, and lastly, gender bias. So I'm going to talk a little bit about each of these. The demand for healthcare has been a perennial issue, and health economics, I may be older than the average person who's listening to this seminar, but I can remember way back in 1983 at the University of York, when Alan Maynard set up the Centre for Health Economics there, which has continued very successfully since then. But health economics was recognized a long time before the economics of long-term care. And inertia applies to academic studies just as it does to other walks of life. And perhaps the fact that health economics was well established before long-term care economics has emerged on the scene is not a surprise. Nevertheless, people are pretty much aware of how population aging has changed the world that we live in the last few decades, with the number of people, for example, in England, age 50 plus, increasing by 47% over the last 50 years. 40 years rather, and the number age 65 plus increasing by 52%. It's not difficult to find statistics. England's not particularly an outlier. There are other parts of the world where the elderly population makes up a much larger proportion of the total population, and societies have been struggling to adjust to the rapid increase in the demand for long-term care. We know that, and the OECD does a lot of work on this, that long-term care is now a significant industry, providing adding value to each country's national output. But we also know that GDP fails to capture important contributions to activity in this sector, primarily that of unpaid care. So in terms of an overall contribution to welfare, arguably that contribution is much larger than the raw GDP statistics suggest. We also know there's a rough correlation. This is proportion of GDP spent on healthcare against proportion of GDP spent on long-term care. And there's a rough positive association with, as always, in terms of healthcare spend, the United States being an outlier. But this association is perhaps more a reflection of cultural as well as economic factors, the relative weight being given to state provision as opposed to family caregiving, with Eastern Europe and Southern Europe perhaps putting more attention on the latter, whereas Northern Europe much more focused on state provision. The issue about data and that being an impediment to the development of long-term care economics is also an important one, because there are many providers of care services. It is difficult to collect accurate data. The use of surveys to discover stuff about unpaid care is tricky. There are all kinds of potential biases that may be associated with trying to gather data from a relatively, well, samples that will only include, in general, relatively small numbers of people that require social care. Since COVID, there has been a massive increase in administrative data associated with social care, and maybe in the next year or two, we'll see some important research findings associated with that kind of data. But compared with health data until recently, the data on social care has been pretty sparse and inadequate. And it reflects what I've already said earlier, the difficulties of collection when countries vary massively in the modes of provision of social care. Measuring outcomes also has been a big problem with long-term care economics. I've got to say I'm an LSE alumnus, so I know a little bit about what goes on down there, and the work in Kent and LSE in trying to develop outcomes measures in relation to social care has been path-breaking, but it's typically far more difficult to get adequate measures for the outcomes of long-term care relative to those that one can get in healthcare. Finally, one of the reasons that I might suggest that long-term care economics has received less attention than healthcare economics is associated with the gender bias, potentially. We know that females make up the majority of care clients due to their longer life expectancy. It's also true that the vast majority of the care workforce, and even greater proportion, I guess, than the care clients are female, and perhaps that has meant that the political impetus behind long-term care, the study of long-term care and policies associated with long-term care have been less successful. These two graphs just showing the proportion of formal long-term care workers who are female, ranging from about 80% in Sweden through to almost 100% in Estonia, and then the lower graph showing the age-specific share of unpaid care providers by gender, and the middle-aged women are by far the largest group who are potentially looking after children, trying to hold a job, and looking after older parents at the same time. And a clear example of the way that the involvement of females in care provision is far greater than that of males. So I made up a little picture, which is far too complicated for you to absorb here, but it's just to illustrate the idea that there are many aspects of long-term care economics that are shared with I guess the standard economics handbook. There are a whole bunch of areas associated with the workforce and the provision of care, of paid for care, and there are a whole bunch of issues associated with financing and the finance sector, particularly in relation to residential care. So I'm not going to spend time wandering through this. If you have a record of our webinar, you can maybe add boxes of your own, because I think there are many areas that of long-term care that do impinge on or that can be answered with the skills of an economist. Okay, I'll hand over to Elizabeth.
Thank you very much, David.
Thanks very much, David. I think that summarises well how we were feeling at the beginning of coming to writing the chapter, and we very much felt that the best way to approach this to be able to describe what we mean by long-term care economics was to approach it in a systematic way to try and capture everything, a huge array of things in the area. So we decided, like, let's do a systematic search to try and identify some of those key issues relating to the economics of long-term care. So that's what we do in the chapter. And we also spend a bit of time in the chapter talking about the key debates relating to some of these issues. I'm not going to go into any detail on that today. We've put the link to the book chapter at the in the chat, and also we're planning on producing a sort of summary version of the chapter to be made available on the Global Observatory's website, because we know that the book is rather expensive. So unless your university library has bought it, might be difficult to get. So we'll produce a summary, but I'll leave the sort of discussion of the key debates to there. What I'm going to do now is just talk through what we did in the systematic search. So we used Scopus, which is Elsevier's abstract and citation database for peer-reviewed literature, and we were limited in the time that we had to produce the chapter, so we decided to carry out a relatively neat systematic search by looking for the term long-term care within the abstracts, keywords, or titles of English language publications within the economics, econometrics and finance subject area of Scopus. We realised quite quickly that a number of key health economics journals are not included in that category. So we sort of retrospectively added in the health policy subject area, which includes some of those key journals that were missing from the economics one. And we might have missed out other things here, but again, we're trying to produce a sort of neat search. So we ended up with 917 results, with 679 after removing duplicates and irrelevant documents, and about 82% of those were articles. It's worth mentioning as well that this search was very much pre-pandemic, and obviously COVID resulted in a huge number of unprecedented deaths amongst those individuals receiving long-term care and working in the long-term care sector. As David mentioned, COVID revealed a lot of weaknesses in the data availability in the sector and exposed some of the long-term failings associated with the consistent underfunding and staff shortages within long-term care. But this has led to a massive increase in academic work on long-term care, and I think that the Global Observatory and the webinar here today speaks to that. A quick search on Scopus now that includes long-term care and the terms COVID-19 produces over 5,000 results. These are mainly epidemiological and medical papers documenting the response to the pandemic there, but I think it would be interesting to revisit this search in the economics of long-term care, specifically post-COVID, because it's likely that the pandemic's also generated an increase in articles relating to the economics of long-term care. But again, we've not done that at the moment, but I think that would definitely be interesting to look at. So a couple of key things that we pulled out from the search. So this just charts the total number of documents over time. And what you can see here is a clear increase or rapid increase in long-term care economics publications sort of from the turn of the century. Maybe not unexpected, given that the long-term care sector is growing as our population is aging and so on. I think also worth mentioning, and David kind of picked up on this a bit, that if we were to chart health economics publications here, we would see that a rapid increase much earlier, from sort of the very early 1990s. And I think that reflects quite a consistent finding that we quite often see that long-term care lags behind health in a number of ways. So we found that here as well. This chart shows the sources that the top, well, it's the top, I think this is the top 10 or 11 sources that the documents from the search came from. So overall, out of the 679 documents, these were published across, I think, about 200 unique sources, and this just shows the top 10 or 11 of them. To highlight here, I think, interestingly, that several of the most common places that long-term care economics articles are being published seems to be within the health economics journal. So Health Economics, Journal of Health Economics, European Journal of Health Economics, they come up in the top sort of 4 categories there. And then the others are sort of financy ones. So we thought that was quite interesting, that that's where a lot of the academic literature in long-term care tends to be published. The next task we had then was to try and somehow group the research into some sort of topics. And this was quite difficult because, as you can imagine, there's a lot of overlap between topics, and just to say up front that these groups are by no means exclusive, and that some articles could fit into more than one grouping. But we felt that these 16 categories kind of stood out as on their own, and we probably could have condensed this more, but equally we could have expanded it. So we thought that this gives a good representation of the different topics that are being studied within the field. And this includes a miscellaneous category where we put everything that didn't really fit into any of these other ones. So I'm not going to go through all of these just in the interest of time, but you'll notice I've put in brackets the percentages and those first sort of 5 or 6 categories. That captures actually over half of the documents from the search. So I'll mention these ones. So the most common research theme was around the demand for long-term care. About 15% of the documents fell into this category, and this really mainly was focused on long-term care insurance and the insurance market, and specifically the puzzle for long-term care insurance and why we see such a low uptake of long-term care insurance. Some papers looked more generally at the demand for services and the sort of implications of population aging. Next, the most common group was the financing of long-term care, and the research in this category really was a lot of kind of descriptive overviews of different financing systems for long-term care. Some work focusing on the sort of financial sustainability of long-term care, and there was often quite a bit of overlap in this category with the long-term care policy category. Next, about 10% of the articles fell into this insuring against long-term care risk, and these were really a lot of sort of very theoretical microeconomic modeling long-term care insurance markets in the presence of asymmetric information and adverse selection, trying to sort of understand variations in individuals' attitudes to risk. So very much highly theoretical kind of work. Next, long-term care policy. This was quite broad, mainly captured analyses of government long-term care policies and their sort of evolution over time and how that fits into the background of an aging population. Around 7% of the articles fell into this unpaid care interactions category, and this was a lot of the work is looking at whether unpaid care and paid care are substitutes or complements. Some work looking at the interactions between unpaid care and healthcare. Also some work on the effects of unpaid care on labour supply. And then finally, the retirement planning category, about 7% of articles in there as well. This was really focused on individual savings and investments behaviour. It included sort of the role of pension funds and housing equity and financing long-term care. So again, with that one, there was quite a bit of overlap with long-term care financing. So those were the top kind of most common themes. And I won't go through the others. We will do that. That is in the chapter, and we'll do that for the summary. But one thing to mention, and David picked up on this as well, is that we didn't find many economic evaluations at all. Again, this might be just to do with the sort of limited scope of the search. But you know, if this was a health economic search, we would expect to see a lot of economic evaluation. So I think that definitely speaks to this theme that we don't see that same level of measuring outcomes and things in long-term care as we do with health economics. And finally here, this is some of the most cited papers. I think this is the top 5 cited papers. We wanted to just check, how does this compare to the groups that we've pulled out and where they're published. So 2 of the top cited papers are on unpaid care interactions, 2 on insurance, and 1 on expenditure, which was a less commonly researched area. And again, the health economics journals are coming through here quite strongly. So in conclusion, and sorry, I think I've gone over a tiny bit there, we found really that long-term care economics research is spread across mainstream economics journals, health economics journals, and medical journals. And again, we may not have captured everything within this search. So there's probably other outlets for this research. But overall, I think that really tells us, and what we sort of concluded from the work was that the establishment of a dedicated journal that's devoted to the economics of long-term care is probably warranted as an outlet for this research. And another thing just to highlight again that David mentioned as well is that we really could see that there's the lack of good quality long-term care data sort of hinders what we can do within the economics of long-term care research sort of field, and highlights the difficulties that there are in capturing things like unmet need, unpaid care, the labour market conditions, and then, as David mentioned, outcomes of care interventions. And I think taking a sort of step back as well, overall, there's generally a lack of theoretical and sort of methodological backdrop and structure to long-term care economics when we compare it to health economics as a field. You can pick up any standard health economics textbook and it'll start from talking about uncertainty, the special features of health and healthcare, and how we should approach analysing and addressing the key issues with economics tools, and that doesn't exist for long-term care. So hopefully that's changing, but yeah, that's something else that we sort of picked out from the work. Okie doke, I'll stop there. Sorry, I've gone over.
Thank you very much, Elizabeth. That's interesting. So in this part, we will have the question and answers led by Professor Van Houten. So
okay, well, thank you so much for that presentation. It was wonderful. While you're thinking of your questions, and if you could put up your hand, I'll go ahead and read out the first question that came into the chat so that we can get more information from the speakers. So this Antonio asks, I wonder if the book, whose title is Economics of Aging, has a chapter with the same goal focused in this even broader and uncertain issue, which is kind of looking at the economics of aging. Do you agree with this idea that the definition of economics of aging would be worth a similar effort, or things like longevity economy?
So I think the book, there are many chapters in the book, and essentially what they're trying to do is cover as many aspects of economics that or bits of economics that can be specifically related to aging. I don't know if there's an argument for aging per se as a kind of area, because I guess I always think of defining sectors within economics as relating to particular markets, and clearly there is a market for long-term care. It's not so obvious that's the case just in relation to demographic change.
Thanks, David. What other questions do people have? Okay, Maria Victoria would like to know, could you describe the content of papers addressing quality of care? It seemed that there were a few papers on this subject.
Thanks, Maria. Yeah, so I don't have the chapter up here now, but from memory, the quality of care work was really focused within the care home setting and residential and nursing home settings. From memory, I can check because we've got the list of all of the papers, but I think a lot of it was within those settings. I'm not sure on outcomes off the top of my head. I can check.
I mean, I've got to say that in terms of measurement and the fact that there is this divide between care in residential homes and care at home, actually is a very important division to constantly be aware of. Elizabeth and I are both convinced that there's been too much focus on residential care, which certainly in the UK is only is a relatively small proportion of the total. And I think the domestic or at-home care poses a huge set of challenges in collecting information, but it always has to be borne in mind that this is the larger sector, and residential care, at least in the UK, at least is important, but by no means dominant.
Adelina.
Hi, yeah, that was excellent. Thank you. Just a bit of a reflection whether, and I know you were limited in time, so don't take that at all as a criticism, but in the UK, a lot of the literature would be talking about social care in terms of long-term care. And I'm aware also that there's quite a lot of publications. I mean, I can think, for example, of Nick Barr's article on insurance that would have appeared in social policy journals, even though it was actually on economics. And I was wondering whether, because of the difficulties in publishing, we may find that a lot of people have published on economics outside the economics journals in this area. It's just a reflection also on how difficult it can be sometimes to publish in this area.
Yes, and I mean, there's also this distinction between social care and long-term care, which is sometimes difficult for people to navigate, and also to write about. I guess, you know, there will certainly have been publications scattered about that we weren't able to pick up. But I guess, as you say, it's just a reflection about how diffuse the literature on key issues relating to the operation of this whole sector seem to be.
Yeah, absolutely. I think it's a great point, Adelina. And as you say, we were very limited in the time that we had to do this, so we very much just went straight for, okay, let's pick the economics, econometrics, finance category, and that will sort of narrow frame the search a bit. I think if anybody has more time, you could do a PhD on trying to produce this this as a well sort of thorough summary. But yeah, definitely limited by the time, and we know. I mean, I know already that the search doesn't capture some of the long-term care journals, sort of that we might expect some of this work to be in. So yeah, that is definitely a limitation of the search.
Thank you. Okay, Sadish, you're next.
Yeah, thank you. I just wanted to actually note the point that Elizabeth also mentioned in the review about the number of limited number of economic evaluation studies around the long-term care, and also shared a paper which is recently published and is funded by the WHO Global Center. And they also mentioned that, I mean, the limited evidence on the economic evaluation of the long-term care, and in my area of interest, you know, the studies are very limited on the outcome evaluations and that quality of life things as well. So yeah, I think, I mean, the work that Elizabeth and David done in this chapter really helps to figure out, you know, what areas are more ignored, what areas of research are really ignored in this topic of long-term care.
Yeah, I guess, I mean, there's always the issue of, in terms of evaluating outcomes, whose outcomes are you thinking of? Is it the person who's receiving care, or in the case of unpaid care, what are the implications of the provision of care for that person or persons?
Yeah, that's, yeah.
I think we have time for one more question. I think this chapter and the presentations really provide a valuable mapping of the established evidence and the distribution across topics, and including some of the questions in the chat. We think that there are a lot of places people could fill gaps. I love the figure that maps the opportunities for economic analysis. David, I think we should have a workshop on that, just fleshing that out. But do either of you have advice for early career scholars about how to help us advance the science and economics of long-term care? What topics, maybe what data sets they should start with? Where are some fertile areas for inquiry?
In my opinion, I should reveal that in a past life, well, not entirely past life, but certainly, I used to place more emphasis on labor economics than I did on long-term care, and the issue of care workers is extremely important in a policy sense at the moment, and we really don't know enough about relatively poorly trained, lowly paid, high turnover, often migrant group of workers. If it was possible to collect good data sets on those who provide formal care, I would say that is at least one potentially fertile area for further research.
How about you, Elizabeth?
It's a hard question. I think because we're limited in what we can do because of the data that we have and the data that's available. So I think I spent a lot of my time trying to push the data agenda and trying to move that forward, because I think, as David mentioned, we've got a long history of using routine healthcare data sets in economic research, and this doesn't exist in social care or long-term care. So I spend a lot of my time trying to improve things in that area so that we can utilize this data that's already collected on this sort of under-researched group of population. So yeah, I think if we can move the data agenda forward, that will be good for research.
If I could put in just one plug, the health and retirement study in the US at the University of Michigan has spawned a whole load of studies of aging around the world, and a lot of the data from these surveys are collected in the Gateway to Global Aging at the University of Southern California, where they also have a sort of compendium on social care policies in the different countries that are within the HRS family, which includes, I think, 70% of the world's population aged over 50. That's a great resource, which has quite a lot of potential, I would think, for cross-country comparisons.
Wonderful. That's now in the chat as well. So I think it's time to pass on the speaking to Cassie Simmons.
That's great. Thank you very much, Courtney. And thank you so much, David and Elizabeth, for your presentation. I think it's provided us a really good overview of, the field of economics as pertains to long-term care. So for the next 12 minutes that we have, this is a little bit more of an interactive part now. What themes or topics come to mind when you think of the economics of long-term care? And now David and Elizabeth have already showed us a really good overview of what literature is out there in terms of economics of long-term care. But we are interested in hearing from you. What comes to mind? What kind of topics do you work on in your own work? So as you can see, as you start typing in your different answers, we'll see them pop up on the screen here. And so this is just a good idea for us to get an idea of what kind of topics everybody in the webinar here today are working on and what comes to mind. So this is good for thinking of future topics for us to hold for the webinar. But I guess it also gives us a good idea of what everyone's working on. So we can see the web is going crazy. So we've got lots of answers here. I see insurance is a big one. And that definitely aligns with what Elizabeth and David had mentioned in terms of the literature. I'm seeing the funding is a big one. Quality is also big. Financing. I see workforce, outcomes. So I see quite a lot of the topics that we've already discussed are quite relevant and quite prominent in what everybody is saying. But I'll be interested later. We'll take a screenshot of this and we can also share it with everybody if everyone's interested. But I'll be interested to look at some of the less noted topics. I think that's also a good idea in terms of informing what are some of the topics that people could look at in future in terms of their research on long-term care and economics. So that's perfect. Thank you so much. I will stop sharing the screen. If you still want to, you can still put some more answers in for the next minute or so. But I'm actually going to switch over to another question. So the next question is going to be a poll within the webinar here. Let's see if I can get that going. And the question is just going to be about asking everyone here how you would like to engage with the economics of long-term care group. So I think I've started it. I hope. Okay, I see some nods. Perfect. So yeah, the question is, in what ways would you like to be engaged with the economics of long-term care interest group? So we've put some examples, some things that we've thought of internally. So we've thought about, trainings or discussions on evaluation or methodological aspects of economics of long-term care. We thought about having some webinars where we invite a researcher to present a research paper and we discuss that, which would be a bit more methodological based. We've talked about having a more thematic approach where we have perhaps a researcher present, but also maybe a policymaker or someone a little bit more policy oriented to discuss. We could also think about having some more informal discussions, just having a topic and just having everybody show up and just discuss ad hoc what we think. And I guess similar to other groups, we will try to be posting research papers on our interest group as they're published and what we think you might be interested in. But if there's anything else that we have not listed here that you might be interested in, please do feel free to write it in the chat or to also reach out to us. We can always think about any other ideas you might have. And the final bit for the last probably 8 minutes or so. So Elizabeth and David have already mentioned some of the challenges within the field of economics of long-term care and ways that this has probably contributed to the lack of focus or, lack of a home for economics of long-term care in a sense. So our question is, in your own work, what are some of the challenges you have been facing in terms of within the field of economics of long-term care? Are there things that we haven't discussed today that you've also experienced in your own work? And maybe if I can ask a more challenging question, a step further, what are some of the solutions? What are some of the ways that we can go about addressing these challenges in this field? So, I mean, we've talked about so far, and I'll go based off of what you've talked about, Elizabeth, especially the data route. I think the data route really is a sort of fundamental basis to a lot of the challenges faced in this field, just simply because if the data is not there, then how are we able to actually carry out any studies? And I think this is I think on the one hand, this is definitely a top-up challenge. I mean, it has to be also thought of from the point of view of governments, of states, and investing in data infrastructure and investing in making data accessible in a sense so that researchers can use it and so that it can also inform policymaking. So I think I'm right up there with you, Elizabeth, in that sense. I see we've also been getting some comments in the chat here. Commercialization, I see Joris van Normelingen has mentioned. If I might not... if I could be a little cheeky, but could I ask you to expand on this, Joris, if you're there?
Yes. Do you hear me? Yes.
Yes, perfect.
Okay, yeah, because we see, I'm from Belgium. We see in Flanders more and more commercial initiatives. That's a good idea, but it can be because long-term care will be a scare good. It will be it will give pressure on the viability of the long-term care, I think. So it's really in Flanders a big issue now.
And so when you say commercialization, are you meaning like privatization of care services, provision of care?
It's growing and growing. First it was more like non-profit and public sector, and now it's more and more private actors with also linked to the shareholder markets.
Mm-hmm. And I think that also plays in quite well into the data limitation side as well. There are quite some countries, I'm speaking from the European side, there are quite some countries where the data from private providers is really, really thin, which makes it very difficult then to have a good overview of the sector for sure. I see we've got some other comments too coming in the chat. Maria also says the lack of data is the main challenge to do any kind of research. Absolutely. Both governments and private providers tend to prefer opacity. Absolutely. And Courtney's also added on to this saying, similarly, the lack of firm or employer data on how informal care affects workers and any supports they offer in this realm, such as exits, changes in hours, productivity changes too.
Yeah, something I didn't raise is, and I think it's important probably in different jurisdictions, is around who regulates care, and if the state is part financing care, what organizations within the state are able to provide finance, and how does that how are their budgets determined, and what level of control have they got? So that in the UK, we've had 15 years basically where local government, which provides social care, has had its budgets incessantly squeezed, and the unforeseen consequence has been huge pressure on social care.
Mm-hmm. Yeah, thank you, David. And I see Christina has also mentioned that long-term care is very dependent from public policies and culture and government's directions. I think this especially is now that you mentioned also culture, Christina, I think this is also something that makes it a little bit tricky sometimes when you're trying to look at the impact of policies and looking at the dynamic between informal care and formal care. There's very much the level of family norms and social norms underpinning it, which makes it difficult when we have to think about the methodological ways we can try to unpack this. I would say we have less than 2 minutes now until the end of the webinar. So I would just hand it back the virtual floor to Sadie so she can close out the webinar. But thank you very much, everyone, for your participation in this section.
Thank you very much, Cassandra. It was just very exciting, and I'm looking forward to the poll result very soon. So thank you very much, everybody. Adelina just posted the link to our interest group, so you can just sign up and have access to the material there and be updated about the next events. So we are planning to have our next webinar for 6th of June, but we will keep you posted. So again, I want to thank you, everyone who joined us today. Our speakers, thank you, David and Elizabeth. It was just great for the first webinar. And I want to thank you all of my colleagues in the Observatory and the interest group who helped to organize this webinar. Looking forward to see you in our next events. Thank you very much, everyone. Well done.